On a cold February evening in 1994, the emergency room at Riverside General Hospital in California moved with its usual rhythm of controlled chaos. Nurses hurried between curtains, machines beeped in tired repetition, and the scent of antiseptic. 31 years old, brought in by paramedics after collapsing at home. She was confused, her heart racing wildly, her breathing shallow and uneven. Doctors surrounded her gurney as it burst through the ear doors, attaching monitors, inserting 4 lines, calling out vitals in sharp, urgent tones. Her skin appeared strangely. Oily and an unusual sheen seemed to coat her body under the lights. A nurse leaned closer to draw blood and paused. There was a faint smell in the air. Not the metallic scent of blood or the sterile bite of disinfectant, but something sweet, something chemical, like garlic mixed with ammonia. They exchanged uneasy glances but continued working. This was a life slipping away, and hesitation meant death. When the syringe filled with Gloria's blood, several staff members noticed something else. Tiny crystalline particles floating in the dark red liquid, glinting like shards of glass. Someone muttered that it looked impossible. Another brushed it off as contamination, yet the odor in the room thickened, crawling into their lungs, settling at the back of their throats. Then the first nurse fainted. She crumpled to the floor without warning, her body twitching as others rushed to help her, her vision tunneling into darkness. Within minutes, the emergency room became a scene of confusion and fear. Doctors staggered against walls, nurses felt burning sensations on their skin. Something was terribly wrong. Through it all, Gloria lay on the gurney, as if she carried within her not just illness, but something unseen and deadly. No one yet understood that the woman they were trying to save might already be the source of a nightmare unfolding in real time. Asterisk as the minutes passed, the emergency room transformed into a place of dread. Staff who had been healthy moments before now felt their bodies betray them. Some experienced muscle spasms. Others gasped for air as if invisible hands were squeezing their lungs. One respiratory therapist described a sudden wave of heat sweeping through her body, followed by paralysis creeping up her limbs. She would later remember staring at the ceiling tiles as her colleagues rushed around her, unable to move, unable to speak. The odor intensified, strange and cloying, sticking to the air like a toxic fog. Several workers reported a metallic taste coating their tongues. Others felt their skin burning as though exposed to acid. Hospital supervisors ordered the room cleared. Patients were rushed out on stretchers, and hazmat teams were called in as rumors of chemical exposure spread through the corridors. Meanwhile, doctors continued attempting to resuscitate Gloria, administering powerful medications, shocking her heart repeatedly in desperate rhythm. Outside the room, chaos reigned. 23 hospital workers reported symptoms that night. 5 were hospitalized. The hospital staff whispered words they rarely used aloud: toxic exposure, contamination, unknown agent. Authorities sealed off the emergency department. Investigators arrived in protective suits, collecting blood samples, testing the air, scanning for leaks or spilled chemicals, yet nothing obvious appeared. All the while, Gloria Ramirez was declared dead shortly after midnight, her body placed in a sealed bag as though she were hazardous material rather than a patient who had sought help. The question lingered in every shaken mind: how could a single woman cause a room full of trained medical professionals to collapse? Some believed it was mass hysteria, a psychological chain reaction born from stress and fear. Others insisted the symptoms were far too real, far too severe to be imagined in the sterile quiet that followed. The emergency room lights hummed softly, illuminating a space that hours earlier had become a battleground between life, death, and something no one could explain. Days later. The mystery deepened in the cold silence of the coroner's office. Even in death, Gloria Ramirez seemed to radiate unease, her body handled with extreme caution, as if it might still carry an invisible threat. Investigators sought answers in toxicology reports, blood analyses, and tissue samples. Yet the findings only multiplied the questions. Traces of common medications were found, nothing that should have caused such a dramatic reaction among hospital staff. Then came the theory that chilled even seasoned experts. Some speculated that Gloria had been using dimethyl sulfoxide, a solvent sometimes applied topically for pain relief if absorbed into her bloodstream in high concentrations. It might have interacted with oxygen during resuscitation attempts, transforming into dimethyl sulfate, a highly toxic compound. Under the bright lights and with defibrillation shocks coursing through her body, the chemical transformation could have occurred in seconds, releasing fumes potent enough to sicken those nearby. It sounded like science fiction, yet it offered a possible explanation for the garlic-like odor. The crystalline particles in her blood, the sudden collapse of trained, arguing that the conditions required for such a reaction were unlikely. Some clung to chemical explanations, others dismissed them entirely, suggesting anxiety and suggestion had amplified minor symptoms into catastrophe. For Gloria's family, the debate felt cruel and impersonal. Their loved one reduced to a case study, a headline, a phenomenon, while they mourned a daughter and mother whose final moments were spent in chaos and suspicion. The autopsy closed without definitive answers, leaving behind a file thick with speculation and a legacy of uncertainty. Years passed, yet the story refused to fade, whispered in medical schools, debated in toxicology circles, and retold in documentaries as the strange case of the toxic woman. Riverside General Hospital would forever be linked to that February night. Its emergency room remembered not only for tragedy, but for the inexplicable wave of illness that swept through its staff. Some of the affected workers reported lingering health problems. Others struggled with the psychological impact of what they experienced, recalling the smell, the dizziness, the terror of realizing something unseen was attacking their bodies. Official reports leaned toward the dimethyl sulfate theory, though they stopped short of absolute certainty. The absence of irrefutable proof left room for doubt, and doubt became the shadow that followed the case. Skeptics continued to argue for mass hysteria, pointing to the power of suggestion in high-stress environments. Yet those who collapsed that night insisted their suffering was real, their symptoms undeniable. In quiet moments, one unsettling truth remained. A woman seeking help had entered a hospital, and within minutes an entire emergency department had fallen into disarray. Whether caused by rare chemistry, tragic coincidence, or something medicine has yet to fully understand, the events of 1994 remain etched into medical history as a reminder that even in places built for healing, the unknown can still slip through the doors. And somewhere in the sterile glow of hospital corridors across the world, the story of Gloria Ramirez lingers like a faint chemical scent in the air, unseen, unexplained, and impossible to forget.